Hello, my name is Fernando Jerez. I am from Guatemala. I'm a political science and work in Center of Study of Governance and Accountability in Health Systems. We work promoting legal empowerment, providing technical assistance to grassroots organizations, and drive applied research in fields of health access, accountability, and issues related to how marginalized community can access uh, health services. For us, social participation is one of our uh, fundamental pillars of what we do, and we try to engage with grassroots communities, grassroots leaders, and with the users of health services. One of the different projects we have, it has been like providing smartphones in which people can document what happened. They could document what happened in video and interview of users of health services. So our evidence of what happened is being uh, delivered directly by the people that use the public health services. Uh, in this, it has been a long process in which we start with a project in which people can put complaints into a platform by SMS messages, and then we start working. In the moment we see people start making use of technology and smartphones, they start recording and put testimonies into recording video and taking photos of the conditions, and we are able to start building audiovisual evidence, very different uh, from what is most common in NGO and accountability in public services and accountability in general, in which people uh, or an organization build reports based on data and statistical information. So we step from that, and we build audiovisual evidence taken by the user of health services. For us, is like a very a big step that we see that it has a big impact in how evidence is perceived by government staff. A chart is something that is faithless. It's cold. It's just numbers. It's just numbers in there. But when you can turn that numbers into stories, give that numbers a human face, the response we are able to document is like people tend to engage more quickly into a human story, uh, and a human face chart that just a cold pie chart and a line of tendencies, which is more common. So we engage in 38 municipalities in 6 linguistic communities. So it's a big challenge, but because we work in a local and regional level, it's more easy for staff of health services to respond of the from the needs of the population if you can present this data in form of human stories. So we work with these grassroots community leaders, which are more than 100 community leaders, provide them assess with um, we provide them training, we provide them uh, uh, the smartphones, we provide technical assistance of how to use a smartphone, how to record correctly, how to take testimonies, how to make questions, and like give them the tools to they engage in their context with the authorities. So that's how we document what happened. We document what happened by working with people, providing with people who use public health services uh, the tools to they can document how they live. what are the living conditions, how they need to take patients in excluded community which has no uh, roads, which has no ambulance, and take these conditions recorded by them to health staff. And we work very close with population, try to maintain high levels of participation in all the process of advocacy, and go in the hierarchical structures of the Ministry of Health, trying to maintain this high level of participation in solving the problems they document. So uh, uh, we were able to document, for example, uh, the process that have to go with excluded communities to get access to health in maternal labor. Uh, we were able to document in photography uh, people with a plastic chair tied into their back and walk 5 hours to get to the place in which they can access transport to go to a hospital. Uh, Previous to that, you go with this finding in data form to a public health staff and say, okay, everything is good because we have an ambulance, two ambulance, and what you tell me is an individual case. But now we are able to document and say it's not an individual case. Everyone who lives in this community with share this condition are living the same. So you need to do something on that. And by putting a human face into that number, we are able to engage more quickly and 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 find a quicker response from government to solve these issues, or start solving these issues. Then we engage in a process in which we are assessing how the solutions that are being implemented at solving or not solving the problems we are identified and people are identified in their living conditions and the delivery of health services. In Guatemala, you have a very fragmented structure of decision making in the Ministry of Health and for resolving health issues. Um, uh, from a territory, you have different person making decisions and health, and everyone is autonomous. So if you have a case of mistreatment in a hospital, you cannot go to the people in charge of health posts because they're independent. So for us, it's very big challenge how to uh, engage in this maze of authorities and responsibilities and bring the correct evidence, because you have this kind of default position in government in which they are not responsible of anything. And in this context, building the correct evidence is very important, and go to the correct authority with the correct evidence is even more important, because in our experience what has happened is, if we engage the authority and we are not bring them the correct evidence, they very quickly step from the table and say, okay, what you are discussing has nothing to do with me. I'm going to leave you with my secretary and whatever, and they step away from the meeting. Uh, for, for in this context, uh, again, building the right evidence is fundamental. And what is good evidence? In your experience, good evidence is not just it's not just evidence. It is good evidence is the means and the way people can talk about how they are receiving and how they are living, uh, which is the experience of the users of the health services. That's good evidence. How we can document the experience, what people have to go all the way to get medical attention. These have to do with not just the conditions of the health services, but access to health services, access to transportation to go to the health services, the conditions of poor communities or empower communities, uh, empower empower communities uh, to get access to public health services. Uh, the 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 language people speak in the health services, if is speaking in the language of indigenous communities, all these elements that are in that intervene in if I can go and receive medical attention or not, or if I can even express how I'm feeling as a sick person to a medical staff which not speak indigenous languages. All that elements that has to do with the experience of the user of health services, we try to document in testimonies, in video, in photography, and how uh, health staff respond to that specific needs of the population they are working with. That's the evidence that uh, we are working, and we are able to document that this evidence has a more impact in advocacy and building accountability relationship with health staff than again these cold, faceless charts and quantitative kind of reports. In our experience, again, working with population is very important. Uh, so we, in our experience, are able to to build up a network of community health defenders called, this network is called Red Salud. So Red Salud, again, is a network of community leaders of all these 8 municipalities. And what we do is work hand by hand with them, make assessment of the situation of health, and make assessment with them about the access of, uh, of public health services, and which are the challenges they are facing in the field to obtain accountability from health authorities. Uh, from that interaction and participative assessment, we build projects, and with that project, we try to find funding for the planning or from the plans we create with them. Uh, then, as an organization, you are in this intermediate position in what you have a responsibility with donor, and you have to present them result, and then you have also a responsibility with the grassroots organization we are working, and present them results too. So for us is trying to find the middle point, because uh, it's very common in here in Guatemala, in which the project are very implemented very vertically. You donor put uh, donor put goals, donor put the money, and donor put the objectives and the priorities. Here is different. Our priorities are given by the people needs. What is the priorities and the needs of Red Salud, and and then be in this middle position, uh, trying to negotiate between the two, and bring this into a good feel in which everybody is happy. Uh, it has challenges because due to the the dynamics proper of a cooperations agency, they think they tend to think very linear. You have this problem, this solution, and in 6 months you have to solve it. And it's not working like that, and it's not work like that. For us, the project we always try to gain funding is Red Salud. It's people, excluded communities, engaging in accountability with the power structure of the Ministry of Health, and accompany them. This process of accompanying them is a peda, 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 good peda, pedagogical for excluded community, and has able to make uh, a kind of a barefoot school of advocacy, of democratic values, uh, of governance. Things change constantly, and you have to be adapt to this change. So there is change from the dynamic in the local level, and there is change always in donor relationship. If there is a new agency, new staff, new forms of make report for the agency, you always in this exercise of being like in the being try to maintain the balance all the time. So how to maintain the balance? You find it trying to find the balance. In something can work in some place in some situation, and this thing cannot work with other stakeholders. So I think more that more that how to balance the need. I think the 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 recommendation could be built on resilience and adaptability. Try to put that like in a focus of an organization. See, like how we can build resilience in of organization in this highly changing environment, in the context of the political context of Guatemala, and in the political culture of Guatemala. I don't feel like nobody is always sure in their stakeholder identification and analysis. It's always kind of a, you have a lamp and in a very dark room, and the light you put is always very framed and very restrained in what that you can point with the light. But again, which is very important, not feel sure, but build this resilience. You say we are going to make mistakes, and we are not. We cannot be in the end sure about why are what are the positions, the interests, and the um, motivations of public staff. In our experience, people change all the time. People can sit with you, make commitments with you, and then they don't open the door for you no more. So you, you can make an analysis, you can identify them, but how these relationships with result, and how government staff are going to react to the evidence you are putting, that's something unpredictable. So again, resilience is more important. How to adapt? Okay, now the most important authority in health in this situation close the door to us. Now what? Here is come the resilience and adaptability. Okay, we have to go to these other authorities. We have to uh, make a press conference and speak to everybody that these people, that this person close the door to the people, and work with different situations to make them return and make them respond from what is the needs of the people. So it's always a constant a process of constant adaptability. And if one door close, we make that other two doors open. But doors doesn't open by itself. You have to you have to open it. You have to be in this adaptation process, trying to make again the conditions in which accountability and change can happen. Change doesn't happen by itself. You need to try to understand which are the forces driving change, and try to be another force in this environment of change.